Now, our projects, rather other projects, are at various stages of design and development. Now, this includes the replacement of 3 existing new central hospitals, 5 new district hospitals, 5 community health centers, and a new psychiatric hospital. To improve patient experience, we are putting more emphasis on reducing waiting times, cleanliness, and staff attitudes in the public health facilities. We are encouraged by the great progress the country has made towards ending HIV and AIDS as a public health threat. By the end of March 2024, 96% of people living with HIV knew their status. 79% of these were on antiretroviral treatment, and 94% of these were on treatment with virally suppressed conditions. Now, to ensure that we reach the target of 95, 95, 95, which has been set by the World Health Organization, we will this year launch a massive campaign to look for an additional 1.1 million people who are not yet on treatment. We are concerned about the potential impact of the decision by the United States government to suspend some of its funding for HIV and TB programs in African countries for 90 days. Now, this funding that we get accounts for about 17% of our country's HIV spend. We have been able, over the years, to provide funding from our own resources, our own fiscus, for our HIV and TB programs. We are looking at various interventions to address the immediate needs and ensure the continuity of the essential services that we might lose if this funding does not come through. Now, to tackle inequality, we do need to undo apartheid special planning, which has scarred our country, our cities, and forced many people to live far away from areas of work and opportunity. We have delivered millions of housing opportunities since 1994, providing safety as well as dignity to poor households. Yet the practice of building housing developments on the periphery of urban centers has in many ways perpetuated inequality and urban sprawl. Going forward, we're going to build more housing in our city centers and closer to places of work and business. Now, we are redesigning our housing subsidies and directing more funding towards programs that enable people to buy or rent a home in an area of their choice. We will release more underutilized state properties for affordable housing development. And we are working with our provinces and metros, and I'm glad that a number of our premiers are here as well. We're working with them to reclaim buildings that have been hijacked in the city centers and repurpose them for public use. Now, we will provide 300,000 service stands to qualifying beneficiaries to enable housing development in well-planned, connected communities along key development corridors. We will clear the backlog of title deeds for subsidized housing, turning homes into household assets. And we will review land use, building, and other regulations to enable low-cost property development, including backyard housing. This represents a fundamental rethink of how the state delivers housing at scale while turning our cities into engines of growth and opportunity. In making our cities work for their residents, we will restore the remaining passenger rail corridors and stations to full service. More than 80% of passenger rail corridors have been returned to service. Now, PRASA has introduced over 200